Hello everyone and welcome to our July newsletter. This is Maureen Maher, founder and educational director for the Center for Continuing Education of Osteopathy. I hope you're enjoying your time in your summer for people who are in the northern latitude, and of course winter for those of you who are down under. Now I decided that I would make this audio podcast for our July newsletter for those of you who are busy on the go and would prefer to hear our news perhaps by listening to it while you're making your morning cup of coffee or in between patients or while you're driving. I know that sometimes your inbox can get really full, and finding the time and energy to sit down and read every newsletter, even though you really would like to know what's out there, can sometimes be demanding. So for those of you who are auditory learners like myself and who want to listen to what I have to share with you this month, this is the purpose of this podcast. And the beauty of it is that you can listen to me while you're doing other things. And if there's something that I talk about in this month's newsletter that interests you, then you can just always go back to the actual written newsletter itself and click on the course or whatever other information and look into it in a little bit more detail. Now this month we're focusing on our Pediatric Osteopathy Certification Program. And you might be saying to yourself, Maureen, why do you want me to think about that in July when I'm going into summer holiday mode? Well, the reason is many of you perhaps don't realize that I also help people with a lot of career planning. And so sometimes you want to plan ahead for what you're going to be doing later on. And here's my logic. If you have any interest remotely in pediatrics, whether it be because you want to work, differently as a manual therapist, because working with newborns is very much different than working with adults. If you want to work with something that's more gentle as opposed to, sports medicine, if you want to distinguish yourself from your colleagues, or if you just have a love of working with mothers and babies, thinking about planning and preparing so that you have the qualifications that you need to be able to start taking any courses with us in the Pediatric Osteopathy Certification Program, let's say later this autumn when you have more free time, is actually a good idea, and let me tell you why. You probably know by now that we have restructured our pediatrics courses to be an all-encompassing certification program that includes 4 to 5 courses, depending on whether you have any prior training in a biomechanical approach to cranial osteopathy. Now, the logic behind breaking up all of our course material into 4 separate courses is it allows you to be able to approach the different aspects of pediatrics in a bite-sized format. It also helps to keep you on track and keep you accountable, because you have to complete the first course before you can move on to additional courses, and you have to submit homework assignments and have some discussions with me. So this keeps you in contact with me rather than you being given access to a whole lot of online course material and left to stray on your own. Now, maybe you didn't know that you can enroll in a bundle which contains all 4 or 5 courses, depending on whether you need the cranial course, but you can also enroll in individual courses. If you find that the Pediatric Osteopathy Certification Program, the entire program, all 4 to 5 courses, is daunting for you, in terms of the commitment time-wise, in terms of whether you're not really sure if you want to work through an entire program like that, or even financially, even though we do have a monthly payment program that's designed for you to pay across an entire 12 months, which makes it very accessible. I can understand that some people may want to take maybe the first or second course only and then see if they want to progress through the other ones as well. And indeed, you can do that. The only thing you need to know is that if you do not have any prior training in a biomechanical approach to cranial osteopathy, and I'm not talking about an up-ledger or energetic style approach, a biomechanical approach is a prerequisite for part 1 of the 4 courses, and part 1 is cranial dysfunctions in pediatric osteopathy, as well as parts 2 and 3, which are assessment approaches, and digestive and feeding disturbances. All 3 of those courses have a cranial component to them naturally, and so having that solid foundation is important. Now, if you've already taken a 3 to 5 year full diploma course in osteopathy and had a solid training in cranial osteopathy, then you are exempt from that prerequisite. But if you do need that training, you might think about wanting to enroll in the Fundamentals of Cranial Osteopathy prerequisite now and work at it leisurely at your own pace over the summer, so that then you can get that out of the way, have that solid foundation. It's a self-paced course, so you can take all of the time that you need to learn a chapter and then practice, and then learn the next chapter and practice some more at a leisurely pace over the summertime. And then if you find that you're ready to hunker down more seriously in a few months from now, you have that out of your way, you have that solid foundation, and then you're ready to start with parts 1 or part 2 or part 3. So that's my logic in talking to you about it now, is saying get the prerequisite out of the way if you need it, so that then you're ready for a fresh start. You know, on a more career note, even though we've been teaching pediatric osteopathy over the years, and we've had over the last 3 to 4 years students who've studied with us all over the world, and it's really makes me proud to know that there are now so many pediatric osteopaths that are available in areas, whereas in the past, I used to be asked to travel out there once a month to help families. There still is a lot of work to be done. There is still a lot of room within the industry for you to choose a specialization like this if you feel it's something that is calling to you. And here's where, if you're not 100% sure and ready to commit to the entire certification program, you can think about taking one of the beginner courses and see how you feel about it. But there's definitely room for specialists, especially if you live in a city or a country where perhaps there already are a lot of generalist osteopaths or osteopathic practitioners. One of the ways that you can distinguish yourself within your city, and even within your colleagues if you're working in a larger clinic, is to become that specialist. So if the idea of that appeals to you, then I'm trying to, like they say in French, mettre la puce à l'oreille, which means to actually just kind of whisper and drop something into your ear in order to trigger you to think about it. I know for myself over the years, because I specialized in areas of osteopathy when I trained that allowed for pediatrics right at the beginning of my career, even though it can be demanding and a little bit stressful and exhausting to be working with screaming babies, I found that it brought a level of deep satisfaction and meaning to my work and my career that really nothing else did. And that's not because I'm necessarily a baby lover, but just because there's something about working with new life, infants, and knowing that it is your hands and your skill and knowledge that are going to be able to take this toddler, take this infant, and give them everything that they need in order to be able to succeed in life without developmental delays, without physical abnormalities. That in itself is really satisfying. Now, if you want to learn more about the course, I recommend that you click on the link in the newsletter. The course bundle or the certification page has a list of frequently asked questions. And I don't want to go through each one of them in detail and bore you here during this newsletter announcement, but just know that virtually every question that you might have is answered in the frequently asked questions section. So if you're thinking about going down this road, then I recommend that you go and read those questions. Now, in terms of subject matter, I just want to go over with you quickly the different courses and what you would learn if you decided to take the entire program. So there's 4 parts to the course. As I mentioned, part 1 are cranial dysfunctions in pediatric osteopathy. And within that course, you're going to learn about the mechanics of the birthing process, different types of pediatric cranial dysfunctions, torticollis, how to treat it, and cranial molding protocols. You also have 3 full-length pre-recorded webinars and various homework and case studies that you would learn all within the field of cranial side of pediatrics. Part 2 is assessment approaches, all of the different basic and more advanced assessment approaches that you would take when a mother comes to you with their child for you to determine what's wrong with them and what needs to be fixed, whether it be you who's able to work on them or whether it means referring out to someone else. Now in this course, you're going to learn different types of assessments. You're going to learn how to do an assessment of a child according to standard developmental milestones. You're going to get a complete understanding of primitive reflexes and how to assess for them and determine if a newborn has retained primitive reflexes. And you're also going to learn a full step-by-step protocol to perform a full body osteopathic assessment. And this course as well also contains some webinars and many videos for you to watch along with practical assignments for you to practice hands-on all of the different assessment approaches that you would need in order to really become an in-depth specialist in pediatric osteopathy. The third course is Digestive Disturbances and Feeding Dysfunctions. So if you have an interest in problems related to breastfeeding, latching and feeding difficulties, digestive disturbances such as eliminating colic, reflux, constipation, this course is going to interest you a lot. In this course, you have 2 full-length pre-recorded webinars, many demonstration videos, and complete treatment protocols. Our treatment protocol for digestive disturbances in this course has 8 steps to it, so it is extremely complete. And many of the steps that you'll learn in treating digestive disturbances in infants actually can also translate into adults as well. And once again, like the other courses, there are downloadable homework assignments for you to do to be submitted in order to complete that course. Now, our fourth and last course is for those of you who are interested in the more orthopedic aspect of pediatrics, gait difficulties, upper limb difficulties, things like shoulder dystocia that can come as a result of a difficult birth, or things like lower limb abnormalities that can present as a child gets older and they start learning how to walk. Problems and dysfunctions, misalignments of the hips, knees, feet, and gait abnormalities can all occur. They're actually quite common. And in the women's groups that I'm part of, I often hear women talking about, you know, my child is now 1 year to 2 years old and he's dealing with these issues of balance or funny behavior in terms of walking. I'm not quite sure what to do about it. Well, if you're a fully trained and certified pediatric osteopath, then you will have advanced knowledge in lower limb abnormalities, how to identify them and how to treat them. And if you want to work with infants that are at that developmental stage, you'll really enjoy this particular course. Now, sometimes some practitioners have asked me whether or not this course involves problems to deal with adolescents or, you know, pediatrics technically within the medical community can go up to, 12, 16, 18 years of age, depending on which country you're in. This particular program is designed for you to work with newborns, infants, and toddlers. And so, of course, each course and subject material is going to come up according to what age a child is at. So if we're talking about feeding and latching and feeding difficulties, well, breastfeeding occurs from the very beginning. So you'll be dealing with children from birth all the way up to 6 months to 1 year, depending on how long a mother chooses to breastfeed. If you have an interest for cranial abnormalities, well, you might be dealing with children from the time that they're born, or things like torticollis, because very often many of the torticollis cases that used to get referred to me used to come from the pediatric and neonatal nurses who would notice that a newborn, when they were born, their head was abnormally shaped, or the head turned well in one direction but not the other. The mother had difficulty breastfeeding because of things like that, turning the baby on their stomach. They were unhappy with their head one way or the other. Nurses would notice this and they would say, take your child to a pediatric osteopath. If you're dealing with things like gait disturbances, or my child, seems to still need to hold on to a banister as he goes up and down the stairs, and he seems to trip over himself a lot, well, you're dealing with a child who's anywhere from the time that they're learning to start to walk until they actually are walking. So the subject matter itself, is determined by what developmental stage and what age the child is at. That's why cranial abnormalities is the first course in the program, because the first thing that you're going to be dealing with a newborn are cranial abnormalities, because they can happen at birth. The next thing is learning how to assess them. That's why that's the second course. Latching and feeding difficulties and digestive disturbances can come a little bit later, when the mother is trying to transition the child to formula from breastfeeding or bottle feeding. So that's why I've made that course the third course in the program. And then movement and gait issues come as the child is a little bit older, and so very naturally we put that course last. Now you should know that every section and every course, every subject matter has a download that comes within the course. So by the time you finish all 4 courses in the program, you will have downloaded about 8 portions of the workbook, and each portion of the workbook is anywhere between 10 to 30 pages. So you are going to have a very complete workbook that you can keep and use for future reference for years to come, even after you finish the program. There are also dozens and dozens of demonstration and training videos that you can come back and watch over and over. And in terms of how long it would take you if you wanted to complete these courses, generally we say that if you are quite motivated and have the spare time, you could complete all 4 courses within a year, where you would take perhaps 3 months to 4 months for each course. Or if you need a little bit more time in between, you could take up to 2 years. Just know that if you do choose to enroll in the entire certification program and you want to be certified, you would have to complete all 4 courses within a 2-year period. So if you wanted to take individual courses because your goal is not necessarily to achieve certification, that's fine. You could take 1 course now, you could take the next course in 2 years from now, whenever you see fit. But if your goal is to achieve certification with us, we do want to make sure that you complete all of the course material within a certain amount of time, and the maximum time for that is 2 years. If 2 years have gone by and you've had delays and you're asking for an extension, we can extend you to complete the course material, but we cannot guarantee certification. If you take 5 years to complete the courses, it's not the same thing than if you've done it within 2 years. So obviously we're trying to give you a deadline to make sure that there are not large lapse in between your studies, so that you can actually claim that you learned this material, that you know it, and that you're currently practicing it. Now remember that the certification program, if you choose to take that approach, then you would be enrolling in the course bundle. It's obviously designed to be more financially affordable and accessible than if you take individual courses. And know that we do have a 12-month partial payment plan, which makes it financially a lot more accessible for you. Now, if you have any other questions that are career-oriented, do by all means drop us an email at ceosteopathy@gmail.com, and we can set up a time for me to be able to talk to you live, to be able to just give you a bit of an idea. Sometimes I act a little bit like a guidance counselor and saying to people, you know what, I want to do this, but I'm not sure when I should start that. How can I go about organizing myself so I can learn this and that? When I have these kind of conversation with students, they find that it was worthwhile in their time so that they can know how to go about planning. So by all means, ceosteopathy@gmail.com. Do not hesitate to drop me an email if you'd like to set up a time so that we can talk, and you can say to me, this is where I'm at in my career, this is where I'm working, this is what I'd like to do. Maybe some of our other courses would interest you best. Some people decide to take our course in treating pregnant patients before they decide to go on to pediatrics. All of that can be discussed very gladly, preferably during regular daytime business hours by phone. Now, we do have some other announcements coming up in our newsletter for this month, including our newly redesigned course in cranial manual therapy designed for massage therapists. So if you are a massage therapist, or if you know someone who is a massage therapist who would like to learn a more tangible, anatomical, biomechanical approach to treating the cranium, we do have a course that we have redesigned that is specialized for you, that contains chapters and sections on how to integrate cranial manual therapy into your massage therapy practice. And we also have our Treating Female Pelvic Dysfunctions course through the bladder and uterus, starting again later on in the month of July. That's a 5-week course. So if you were to start it in July, you would have up until sometime in September to submit all of your homework assignments and probably have your certificate of completion within a few weeks after that, if that's something that you're interested in doing. So I want to thank you for taking the time to listen to me. I hope that giving you an audio version of our newsletter instead of or in addition to a written approach is something that you find valuable. Please send us feedback, let us know. And if this is a format that you like, we will continue doing that with our newsletters each month. So this is Maureen Maher, Educational Director for the Center for Continuing Education of Osteopathy, signing off and looking forward to hearing from you. And we also soon hope to have some announcements for some live practice days and live courses coming up in September and October, but we will announce that when all of the details are in place. Hope you have a great day.